Clavicle. In Latin, clavicle means small key. Also known as beauty bone and collar bone. Views of clavicle: anterior view, posterior view, lateral view, medial view, superior view, inferior view. Peculiarities of clavicle: first bone to start ossifying. Only long bone which lies horizontally. Only long bone which have two primary ossification centers. Side determination of clavicle bone: lateral end is flat. Shaft is slightly curved. Medial end is large and quadrilateral. Shaft is convex forward in its medial 2/3. The clavicle bone concave forward in its lateral 1/3. Inferior surface is grooved longitudinally in its middle 1/3. Bony features of clavicle bone. Clavicle. It is roughly S-shaped bone. It has two extreme ties. Medial is sternal extremity. Lateral acromial extremity. Muscle attachment of clavicle bone. Sternocleidomastoid muscle. Rough superior surface gives origin to sternocleidomastoid muscle. Capsule of sternoclavicular joint. Fibrous capsule of sternoclavicular joint all around. Deltoid muscle. Anterior border gives origin to deltoid muscle. Trapezius muscle. Posterior border provides insertion to trapezius. Pectoralis major muscle. Anterior surface gives origin to the pectoralis major. Trapezoid and conoid parts. Subclavius muscles. Subclavian groove gives insertion to subclavius muscle. Sternohyoid muscle. Posterior surface close to medial end gives origin to sternohyoid muscles. Costoclavicular ligament. The oval impression on the inferior surface at the medial end gives attachment to costoclavicular ligament. Capsule of acromioclavicular joint. It gives attachment to the joint capsule. Revision of muscle attachments. Trapezius muscle attachment shown in diagram. Function of clavicle bone. Acting as a flexible, crane-like strut, it allows scapula to move freely. It serves as a rigid support from which the scapula and free limbs are suspended. Covering the cervicoaxillary canal, it protects the neurovascular bundle that supply the upper limb. Transmit the physical impacts from upper limb to axial skeleton. Applied anatomy of clavicle. There are two clinical conditions of clavicle fracture. Commonly fractured by falling on outstretched hands. Common site of fracture between two curvatures of bone. Cleidocranial dysostosis. Clavicle may be congenitally absent or imperfectly developed in a disease called cleidocranial dysostosis.